Well, hello, everybody. Here it's Teresa Sanderson. Oh my gosh, I'm excited to connect with you for another episode of Dare to Do Nursing Differently. I have an amazing guest with us today. Her name is Madeleine Kelley, and I had the pleasure of meeting Maddie at the Vive conference in Nashville just last week. Welcome to the show. Glad to have you.
Yes, thank you so much for inviting me on.
Absolutely, absolutely. And for those of you who don't know Maddie, she is a board certified psychiatric mental health nurse practitioner. And she works with an organization called Andrews. Is it Andrews Healthcare? And what they do is this is a really, I think, unique organization and just shows business at its best. Find a need and fill it. This organization, Andrews, is in Florida, and they saw that psychiatric patients were not getting home visits. They weren't getting the care they needed. And so they saw that need and created Andrews Consulting and Healthcare Andrews Healthcare, I should say, to solve that problem and fill that need. So again, welcome, Maddie.
Thank you so much.
Yeah. So my audience is a lot of nurses and a lot of nurse entrepreneurs, and we really love to learn about who you are as as a nurse, a person. So tell us a little bit about your history. How'd you get started in nursing and what kind of work have you done?
Sure. No matter what you do in your education, you're always going to be that nurse at heart. So I got started actually way before I was even out of high school. My grandmother, I call her Nana. So my Nana was a nurse back in the 50s.
Oh, wow.
And she would tell me all the stories of her nursing school adventures, because back then they were paired to a hospital and how much it was different. And I had some good influences with not only her, but then I get into high school and had the amazing opportunity to be in a health science program where I graduated as a CNA and got really some hands-on patient experience. And I have to give shout out to my instructor at that time, Mrs. Betty Davison. She has since passed, but she was phenomenal nurse, phenomenal lady, phenomenal nurse educator. And she really inspired in me the fact that that I could keep going and do nursing, and that even though some of the content may have been a little bit difficult or I wasn't as motivated as I probably should have been at some times being in high school, she pushed me to be that. And she really kind of, I'd like to say she put the fear of God into us, because she made sure we mitered our corners on our beds and all that kind of good stuff.
Oh,
So
I love that.
I love that, right? So I still do that to this day. So I had some really good influences in a really important time of my life as far as figuring things out. I knew from an early age I wanted to do something in healthcare. I wanted to make a difference. I wanted to help people. So having those really awesome nurses kind of guide me in that direction. So then, of course, I go to college. I become a nurse, and it was through my second degree, actually, my sociology degree, that I found a love for psychiatry and sociology and kind of like what makes people tick. And so in nursing school, you all have seen this, where you sit down in your first day of nursing school and everybody says, okay, so what kind of nurse do you want to be? And so all the little hands go up: emergency services,
Yep.
OB, and then psych. And there'll be like two of us with our hands up. But it was something I really fell in love with. My Nana had the opportunity to do some psych nursing in her college, like when she was going through school. I just was fascinated by the stories, and just as I got to learn more of the history of psychiatry and psych nursing, really just fell in love with it. So psych has been my passion. When I got out of school, I did my year of med surge, like we all are do. Got some really good assessment skills that way. And then I went straight into psych, and I worked at the state hospital that's in Florida. It's located in McClenny, Florida. So it's more of a civil based state hospital setting. Worked there for a few years, did on the floor nursing, then worked into management. And then I was trying to finish my master's, because I knew that I didn't want to just stay bedside. I didn't want to stay educationally at just a bachelor's degree. I knew that I had the desire to go on and do more. So I finished my master's. I did psych home health for a home health agency in Florida that really worked well with my schedule. And now here I am. And Logan and Logan is my business partner. He is the owner and the founder of Andrews Healthcare. You may also hear it as Andrews Healthcare Consulting. So same company.
Got it.
And so we literally grew up in two rival areas. So it's called a bridge. There's a bridge that connects the river. So I'm on one side and he's on the other. So we grew up, on opposite banks and as rivals in high school, but we both had the same kind of vision as to, we want to come back here and we want to fix the area that we live. We live in a very rural part of Florida. He saw the need for the primary care side. When I got out, before I was even out of school, he was chomping at the bit saying, hey, I really want you to come on board. There's a huge need for psych. It's somewhere that that's not really my specialty. And I'm treating it in primary care as most primary care practitioners do. But I really think this would be very beneficial. I was already doing it as a psych home health nurse. I was already going out and doing psychotherapeutic interventions. I was there, talking to them about their psychiatric medications, sometimes administering injections if they had long-acting injectables. So I knew the need. I was in the need. I saw it. So I came on board. It was a seamless transition. I mean, I say that now. But as far as the workload goes and the patients go, it was seamless. And so now I've been with the company since 2022. We were founded in 2021. And we were just literally leaps and bounds. I mean, it was really cool to meet you at the Vive conference. That was something a couple of years ago I would have said we'd never be in a situation like that, but here we are. So that's a little bit about my journey.
I love it. Oh my gosh. And I just love that you and your business partner are on just opposite sides, opposite banks. I love that. That is so great. That is so great. So you've made the transition. It sounds like, as you said, very seamlessly, right? Going from your regular, you can say that now. I know what it was like at the time, trust me. But so how do you serve your clients now? Tell us a little bit about, if a patient connects with Andrew's Healthcare, how does that work? How do you guys do what you do?
Sure. So we get referrals. They can be self-referrals. We have some really good referral sources only because we are in a super rural part of Florida. So when they hear about us, they're like, oh, we're going to send you all the referrals. The first day I went live, the fax, and Logan loves to tell the story because he just laughs his head off about it. The first day I went live, the fax machine started going and did not stop. And I had about 100 referrals the first day I started. No joke.
Oh my God. Yeah.
So once we get a referral, I literally see patients everywhere. I love the motto that I try to use, that's I'm meeting them where they're at, because I see patients, like right now I'm in our outpatient office. So I see patients here at an outpatient setting. So what you would think of as like a traditional psych visit. Then we also do, of course, telehealth, which is extremely helpful. With all the changes, like psych is kind of exempt still a little bit. We're still kind of figuring out what DA wants to do with us there, but I still can see patients via telehealth. So the times that I may either be hung up or someone needs a visit like within the week, and I can fit them in that way. And then I also do what's real, and this is like, really important to me, and what sets us apart is that we do home visits. So we actually go out to the patient's homes. This can be their like a physical home. It can be an assisted living facility. We even go into the skilled nursing facilities. We meet them where they're at, and we treat the patient where they're at. And I think that to me has been the most beneficial, but also to the most gratifying, because we truly, in nursing, we have a holistic model, right? We look at things. We're looking at things that aren't even on the patient. We're looking at their family structure. We're looking at literally everything. And that is a really good snapshot, seeing somebody where they're at. So I really appreciate that.
I agree. And just hats off to increasing access to healthcare, the quality, the experience, all of that. I mean, it's huge. I'm from a very rural area in Kansas as well. And, I joke about this. We live in a town of 200 people, and my husband and I live 3 miles south of town. Okay. So,
you're not in town.
No. We are in the middle of corn and wheat fields and all that kind of thing. So, well, what do you enjoy most about working for yourself?
So truly what I enjoy most about working for myself is the independence. And I'm trying to really be mindful of the words that I use, because in the state of Florida, psychiatric nurse practitioners, we still do not have autonomy.
Okay.
A lot of people get that confused because they're like, well, you are
Right.
doing your own thing. And I am, however, per the state statutes and guidelines, I do have a collaborating physician that is remote.
Mhm.
So
Yep.
I still operate underneath the same statutes, all those things, but I would have to say it's the independence. So if you are tied to an office and you're expected to see X amount of patients a day, if something comes up in your day, like for example, my dad had surgery yesterday. He's fine. It was an outpatient procedure. However, it kind of put a wrench in my plans because I had patients. So I was able to finagle them for telehealth. And so he was back getting his surgery and I was in my car doing a private.
There you go.
So having that independence to do those types of things, having the independence to choose where I want to work and the clients I want to see. And being, being back in my hometown and in the surrounding areas, that was very, very important to me. That was extremely, I mean, I saw the need back when I lived here in high school and there was just nobody. And since then, there hasn't, in about 20 years, there hasn't been any changes except now here we are filling that gap. So
Right.
that is really important to me. That is something that you cannot get anywhere else. And that is so fulfilling, is being able to be your own boss.
Absolutely. Oh my gosh. And I think you hear so much of people talking about, I want to go into entrepreneurship. I want the freedom. I want this. I want that. Freedom looks different for every person, I think, and there are different levels of freedom. There's financial, there's just, time freedom, flexibility, all these things. And so I love that, you and I are very aligned that way. For me, it's about being able to work from anywhere. And
Yes.
as long as I have my backpack, that's my office. I can go anywhere and do what I do.
Exactly. Exactly.
Yeah, yeah, I love that. Well, great. So, you and I both know there are nurses all over the country, nurse practitioners, nurses at all levels who are wishing they could start a business, right? They wish they had more. They're looking for more. Lord knows right now with everything that's going on in healthcare with nurses, I think it's a very, very challenging time. What is the one piece of advice that you would give to an aspiring nurse entrepreneur who's just thinking, I really wish I could start a business. I have no idea how. I don't think I have the skills. What would you say?
So I'm going to try to condense it all because there's so much. But I would say first off, the number one thing, and this was instilled in me when I was in nursing school by a very, very special lady, Doctorate of Nursing Practice that we had for our leadership clinical. But she told me, invest in yourself first, whatever that looks like. If that means going for more education, if that means investing in an idea or a business model that you really believe in, do it. She said, because, the money's going to be there. If you're passionate and you believe in yourself, the money will come. You just have to, if you have the drive, then you invest in that drive and you go for it. A second thing I would have to say that has really been helpful is networking. I know that kind of gets beat into the ground, but it is so important to network. It is so important to reach out. One of the things that I kept hearing at Vibe was like, we're all on these little islands. And being in organizations, like one of the organizations that I belong to is NNPEN, which is the National Nurse Practitioner Entrepreneurial Network. And that's what we hear all the time, is we feel like we're little islands out in the universe. And some of us are doing very similar things that we could connect and really help each other. So if you have a business idea or you have an idea for something that you're like, this is something that would be beneficial in my hometown. Look, that's how we got started. We started with 15 patients. We have 4,800 plus now. Like, if you have an idea and you think it can impact your little piece of the world, research other people that are doing it. We are not closed off. There's plenty of patients for everyone. There are plenty of people that need quality care, and we're not going to gatekeep on that. We're going to, help you as much as we can and expand. So connect with people that are doing similar things. Invest in yourself and keep going. That's the third thing. Keep going. Just believe in yourself and keep it up. There's the
Wow.
site.
I love it. I love it. So much gold wrapped up into that, from the keep going to find other people who are already doing the thing that you want to do. Absolutely. And one of the things I notice in nurse entrepreneurship is that the culture in nurse entrepreneurship is very different than the culture in traditional nursing workplaces, right? It's a very empowering place to be, and it's a place where nurses do lift each other up, I believe, in nurse entrepreneurship. And so yeah, it's a Great advice. Great advice. Love it. So before we finish up today, Maddie, I want to give you the floor and just allow you to share with our audience, how can they connect with you outside of this interview? If they want to reach out, how can they find you?
Sure. So we have a pretty large social media base. It's free advertisement. There's another free business tip. So you can find us on Facebook at Andrews Healthcare Consulting. You can also find us. We do have a website, andrewshealthcareconsulting.com, and we're in the middle of fixing some of that, so making it look a little bit better. We're just updating it because we have so many changes going on. Our office number, if you're local, so when I say local, I mean state of Florida for now. We are working diligently on expanding and doing some telehealth, psych, and primary care in some other states. Of course, that requires licensure, DEA, so it's a little bit slower. But for now, if you're in the state of Florida and you're looking for primary care, we're located near the Gainesville area. So you can reach out to our office at any time. It's 352-577-5252. And then I'll even give you my email for those that are looking for some entrepreneurial networking, or maybe just any ideas. Also, too, I precept nurse practitioner students, and I know Logan and some of the other members of our team do. I know that's like a really crucial thing right now. So
Yep.
my business email is PSYCH at andrewshealthcare.net. It just changed. So
Okay.
please reach out if anyone has any questions. I'm already partnered with a lot of schools, but I know that just in that little tidbit can be helpful. So at any time, reach out. We try to update our Facebook pretty often. I know we're millennials, so we're aging ourselves a bit there with the Facebook, but it's easy. We have access to it. So we update our pictures and what we're doing. So that's kind of like our main feed. So if you want to see like a day-to-day or even a month-to-month thing of what we're involved with, we stay pretty involved. That would be the best bet. So we hope to have some new followers, and please, I always encourage any questions about what we're doing, any feedback or any advice you need. We'll be happy to help you.
Wow, incredible. Thank you so much for sharing all of that. And you guys are making an impact in a lot of areas, from the primary care to psych, the home visits, precepting. This is all so meaningful. So thank you, for the work that you do, because nurses now more than ever need the support and resources. So I appreciate you. And thank
Yes.
you for joining me today. Yeah.
Yes. Thank you so much.
All right. And for everybody who's tuning in, I hope you enjoyed this episode. This concludes our episode of Dare to Do Nursing Differently today, and I will see you next time. Bye for now.
Bye.